All right. Good evening. Good evening, Conrad. Good evening, Nahreen. How are you doing?
Good evening, Zahir. How are you?
Very good. Good. So, tell us, Nahreen, what are you doing now?
So I am currently in Gallup, New Mexico. I'm working with the Gallup Indian Medical Center and their hotel motel isolation program, which cares for a large proportion of the Navajo patients here with COVID. And I'm helping out with their responses. They were one of the hardest hit places in the nation.
Hmm. How about you, Conrad?
So I'm an infectious disease doctor, residency program director in a large central hospital, central Brooklyn, in New York City. We have somewhere between 40 and 50 patients now, down from 240 at the peak, down from 70 about 3 weeks ago. I'm in a community that's 80% African American and 14% Hispanic.
So, Conrad, Nahreen, of course, you're a critical care specialist. You're also a board member of Med Global, among many other organizations and hats that you are wearing. Same thing with my friend Conrad. And the reason that we're talking today, and this is done without a prior planning, is because of this milestone that we reached today.
Yeah.
100,000 patients died in the United States because of COVID-19. 500,000 patients, 500,000. Um, this is horrifying number. That's a very grim milestone, as President Biden said today. Um, I mean, do we understand the gravity of the situation? I mean, uh, from healthcare providers to the public to policymakers, do we understand what 500,000 people dying of one disease in 1 year means? It is more than uh, Americans who died because of Second World War, First World War, and Vietnam War combined. What does have 500,000 people dying of COVID means to you, Conrad?
So when you say that we're not prepared for this evening, what Dr. Salul means is that we didn't prepare in terms of presentation. From one point of view, you could say that the three of us have been preparing for this our entire lives.
Hmm.
We have been preparing for this our entire lives. That when the struggle is most intense in this world, we will not be found wanting, nor will we act and hide with cowardice or hide away in a very frightening circumstance. John Donne said, "Ask not for whom the bell tolls. Any person's death diminishes me, for I am involved in mankind." So when people say this place or these people or that people die, we have to say anyone's death diminishes me. Anyone's death diminishes us if we are involved in mankind. And we have to say, why is it that 500,000 dead, more than all of World War II? But World War II got a monument on every street corner, a plaque, a statue, angels bringing people into heaven. Yet somehow this feels different. Why does it feel different to people? It doesn't feel different to the three of us. But what is it that we need to inject into our society, into our politics, to have people feel these deaths? Is it somehow less valuable? Until World War II, more deaths died in the American Civil War, more deaths occurred because of infection in every war, until only very recently. So we're here today to help our civilization process the enormous pain and weight of this tragedy. And that is what I would like to know how best to do. And when you don't know what to do, you ask your ummah, what are we going to do?
Yeah. Yeah. I mean, to me, it's, and I mentioned that last time, that 100 years ago, we lost about 500,000 people because of the Spanish flu. At that time, we did not have ICUs, we did not have ventilators, we did not have antibiotics, we did not have critical care specialists or antiviral medications or vaccinations for the influenza. And in the 21st century, we lost similar numbers, and this number is expected to get even worse. Some projection will say 600,000 people will die by June of this year. Every day we have 2,000 people who are dying on average, although the numbers have been decreasing since in the last few weeks. Nahreen, what does 500,000 people dying of COVID means to you?
I mean, for me, 500,000, 500,000 deaths. I can remember the faces of each patient I've lost, the family members I've talked to. It's personal. And that number, I think, becomes really challenging because it's so large. And I don't know how much the public has been able to see those that have lost family members. They don't look at the number, they remember the person because that's who they lost. It's so personal and deep to them. I feel that way too. And looking at that number, I think about all of my colleagues, nurses, physicians that worked hard, not only the family members that lost their loved one, but those of us that were trying our best to keep them alive. And thinking through 500,000 deaths means 3 times, not maybe 4 times that many people that tried to help them stay alive. And those people that will be traumatized, the system that's traumatized. This number is just a piece of the puzzle and a huge piece of it. And how do we, I feel like the numbers became politicized, and the more and more we talk about them, the less they become real to people. How do we create this as a real image that people can really think about in a tangible way? Because 500,000 deaths, to me, I'm worried that the entire world is just looking at this as a number and forgetting the faces of the people that we lost. And I think there is some numbing to the numbers because of the fact that I think it's almost too hard for people to visualize. It's too hard for them to imagine. It's a shock to the system. How can people even think about 500 deaths? What does that mean? I think it's a combination of being numb to the numbers and also just unable to process them. How do you process that many deaths? It's I think a mind-blowing thing to think about.
When I used to go to Syria in medical missions and come back and speak to people and have presentation about 6 million people who are refugees and 500,000 people who died because of barrel bombs and chemical weapons. Um, I feel that the public did not understand the gravity of the situation. Then, when I used to describe to them one child who was mutilated or maimed because of the barrel bomb, I see tears in their eyes. Is it a problem, maybe, that we have not described these one patients that we have witnessed to the public so they can understand that this is personal? Um, Numbers do not mean anything. Statistics do not mean anything. You can talk about 6 NFL stadiums full of death, and it doesn't mean anything to the public. But if you talk about one patient, then it means a lot. Um, Maybe you should describe this one patient. Conrad, I'm sure that you have this one patient that stuck in your mind uh, with COVID, died because of COVID. Do you remember such a patient that still, you have that patient in your heart, in your memory? You think when you think of COVID, you think of that patient.
When I was in medical school and a seeker of knowledge, and I found someone who was at that time, I thought I was going to be an actor. And so I chose my residency because I wanted to be in mid Manhattan. And they said, "Why'd you choose that particular hospital?" I said, "It was near all the theaters and near the acting classes." So I had an acting teacher. She was what, in one sense, now would be called a life coach, but that's not a deep enough term. Very deep lady. Used to honestly kick my ass for many years. And she's became my oldest friend. And she developed COVID. She's an Academy Award nominee. Supported one of her films to make. later in life as a documentary, which is nominated for the Academy Award. She's a very private person, so I won't say what her name is. She liked to be invisible. And she was a great leader and teacher for many people that I would consider many of my friends and many people who, everything from waitresses to hedge fund managers and hedge fund owners, everything in the middle. And I was in her apartment when she, in the middle of the night with COVID, was just fine until she desaturated and then died about 3 weeks ago, and was part of her resuscitation on the way into the emergency room. And she died, one of my longest term friends. There are many people who had to say goodbye over Facebook, over iPads. So are we going to remain islands? Are we going to let every human being, whether it is a poor single mother in Missouri or Kansas, or someone in a camp with the Rohingya or the Syrians, or someone in South America or Europe that does not have our advantages, be an island unto themselves? Because if one of them dies and we are the world, then the world, the continent of humanity, is the less. And the question is, how can we help people to absorb and have the emotional endurance to bear tragedy of this loss? That our world, our continent, our civilization is less when every single one of those precious souls is lost. There's a defense mechanism to say, they're old, they're fat, they have comorbidities, which blames the victim. Classic social work therapy. Well, he wouldn't have attacked you if you hadn't been wearing that. You're going to continue to blame the victim? No. We have the medical, political, spiritual, and emotional duty altogether to help each other to bear this sadness, that we are the less because of these individuals. How do we help people bear that?
In the scripture, it says that whoever saved one life, as if he saved the whole humanity, and whoever killed one life, as if he killed or she killed the whole humanity. So let's talk about this one life that you saved, Nahreen, with your work because of COVID. Can you describe that one patient that stuck in your mind and you felt that the medical system and with your help and the help of the medical team, you were able to save his life or her life?
So that's it's an interesting question because so many people always ask about the lives we've lost, and you've now asked me about a life saved. And I think what's so great about that question is to remember the positives also, that the saves that we did have. There is a patient that distinctly stands out in my mind who I was asked to see as a critical care consult. I was called to the general wards because the team was very concerned about this particular patient. And I spoke to him. He was anxious. He was nervous. And I could tell he needed a higher level of care. He needed to be in the ICU. We moved him preemptively, mostly because I had some concerns about his imaging. The nursing staff were very vocal about saying, "Hey, look, we're worried." And immediately it reminded me of the team effort that went in and goes into saving patients' lives and listening to our colleagues when they tell us, "I'm worried about somebody." And I thought that communication was really something that showed me how well our system works when we speak to each other and communicate clearly. We moved this patient to the ICU. We kept a close eye on him. We had him on high flow nasal cannula. He got all the therapies, and he made it out of the ICU and he made it home. And he wrote a beautiful letter to our staff in the ICU, and to all of those that took care of him, saying thank you for saving my life, because I truly thought I was going to die. And hearing him say that throughout the process of his hospitalization, and those of us worrying about his safety as well, it was an amazing thing to see him survive. And that reminded me that when we work together and when the system works, it's fantastic. We get to send people home. The one thing I would say is, of course, we remember those stories a little less, unfortunately, because we're hit so hard by the patients that we've lost. And I can tell you, unfortunately, I remember much more the stories of the patients that I lost rather than the ones that we saved, because that will stick with me forever, until the very end. I don't think the trauma of this will really ever go away for any of us. But it is nice to be asked about the people we saved, because oftentimes we forget about that. And that's such a big part of what we're able to do. But I think truly we're left with the mark that the losses left on us, more so than the saves.
Yeah, I mean, for me, it's very difficult. I mean, there are many patients I remember, patients who made it and patients who did not, unfortunately. And you mentioned trauma. I think, and this is something that I learned from again medical missions in disaster regions, that as long as you are in the middle of the war zone or in disaster, you don't feel the trauma on yourself.
Mhm.
The Later on, after the disaster, after the pandemic, then you start to feel it. And what I'm afraid of, that many of the frontline healthcare workers, including Conrad, yourself, and myself, and many nurses and respiratory therapists who've witnessed and lived this crisis day by day. All of us got infected, by the way, right? Nahreen, did you get
I
infected?
didn't. I was lucky. Yeah.
Yeah, Conrad got infected. I got infected. We lost days. We got vaccinated, and I did not recover my taste and smell, sense of smell until now. So these things will stay with you for the rest of your life. And I think a few months from now, few years from now, we will discover the magnitude of this problem, because it did not only affect the patients and their families, and patients who recovered but still have problems for a long time for the rest of their lives, but also it affected all of us. Um, I remember this one patient who stayed in the hospital for 2 months, and his family used to come every day, and his wife sit near his bed. He got intubated, he got infections, he got renal failure, he got all kind of complications, and I saw him every day, and then he died, and that was a tragedy for his family. His daughters all are in the medical field. They loved him. His wife loved him, and the community lost him. And these patients will stay with you. It stayed with me. So I hope that people understand that the 500,000 people that we lost, we did not only lose numbers, but we lost human beings who had life, who had families, who had communities that care about them, and that will not be forgotten. Um, I mean, 500,000 still, I mean, it's very difficult to swallow this number in the United States. Anyone should be held responsible. Con- Conrad, what do you think?
In terms of feeling the largeness of this impact on our, this is supposed to be a civilization changing event. This is supposed to be an impact that changes the way we think about each other. This is supposed to be where we take regard for all humanity as equally valuable. It's supposed to be that level. But when you start out at the beginning of the pandemic and say, I don't want to let people come off of the cruise ship because they're infected, where the previous president, like Lord Voldemort, he who shall not be named, says, I don't want those people on the cruise ship who are infected to come off because I'm concerned it will raise our numbers. I'm concerned it'll make us look bad rather than the lives of those people. Right from the very beginning, the role modeling was despicable. to diminish the deaths, to never appear at a funeral, to never appear at a funeral, to never say, this is a sad time for our country, to not feel the weight, somehow thinking that people would think less of you personally. First of all, it's an error in judgment. It's not factually correct. People don't think less of the pastor, of the imam, of the rabbi. Second, it eradicated the meaning of those deaths by saying the virus is not real. It's going to go away any day. If you wear a mask, you're a political fool. The main thing here is there is time for us to realize that we're not just sharing a common dwelling, but a common endeavor. That we're not just sharing a city, but we're in a common effort. And when we're here together across multiple places around the United States, in 3 places across 3,000 miles, from the East Coast to the West, as they say, like this land is your land, this land is my land, right? That's us right now, isn't it?
Yeah.
That we say the words of Beethoven's Ninth Symphony, the Ode to Joy. It's really Schiller. There he goes, "Oh, you millions, I embrace you with a kiss for all the world." And that's what we can get out of this. Oh, you millions, I embrace you with a kiss for all the world. And that is what we can still do to pull this out from the previous mistake that was made of leadership. That's what I would get out of being with us all here together, making new friends.
So, Nahreen, you mentioned something before we went live about how this calamity heightened healthcare disparity, and you are right now volunteering in a coalition where you have probably the highest number of deaths due to COVID per capita within the United States. Um, how should we reflect on this?
Yeah, I think that's really the mark. When you look at the deaths and the distribution of the deaths, uh, patients who are from communities of color or indigenous populations were 2 to 2.5 times more likely to die of COVID. If we don't recognize that and move forward to make the changes we need to make in the healthcare system to increase access, to change the way we practice medicine, to beat out the systemic racism that was found in the process of this as well, that I think has to be the lesson that we take from this alongside of so many others. But that has to be part of how we respond and how we move forward in recognizing the problems in our healthcare system and addressing them, because that is an inexcusable number, that our vulnerable populations are populations that are in low resource areas of the country, of the world, were affected the most. And that means we have let people down, and as a government, as a healthcare system. And I think as we move forward to repair ourselves, that has to be a part of the conversation, crucially, a part of advocacy, policy change, right down to how we're training our medical students. And I think that has to be a big part of how we move forward.
Conrad, any final word of wisdom?
I want us to have a society that values every person as a individual soul of unlimited possibilities. Now, from one point of view, I don't believe in that thing that like every job is the same. Now, from one point of view, yes, politically, spiritually, yes, that's true. I had a very close friend of mine who was a lady who stocked the shelves in a supermarket for 40 years. And people used to say to her, didn't you ever want to do anything more? Didn't you ever want to like develop into anything? She's like, what are you talking about? I put my children through school. I take care of my grandchildren. And, I put the cans on the shelf in just the right way. So when anxious mothers who are in a big hurry and very frustrated come into the supermarket, they can find exactly what they need in the easiest and fastest way. What are you talking about? I'm building the kingdom of heaven when I stock the shelves. So from one point of view, all things are equal from a spiritual and political point of view. But our responsibility here as the doctors is to reaffirm this fundamental value that says we are going to affirm that the values of the love of humanity is deep in our hearts. We care for people we haven't even met. And that's what we're going to do. So we're going to find a way to be able to celebrate in our society the love of the virtue of doing good to people. Yo, dude, on the day of judgment, I stand with the widow and the orphan, right?
Well, thank you.
And so there it is. So now I get to meet nice new friends like here this evening. It's great. Who can't tell? I might end up in New Mexico next week.
Well, I hope so. I am looking forward actually to volunteer with you, Nahreen, at one point in New Mexico, and maybe other places, Bangladesh. Hopefully, when the travel restrictions are relaxed more. I'm actually going to Syria next week in a medical mission to Idlib, so to assist.
Don't die.
I'm planning to come back, inshallah. Right. So keep us in your prayer. Thank you very much, Conrad and Nahreen, for joining me, and hopefully we'll meet again soon.
Okay, but I'm going to come and rescue you, Zahir. I will come and rescue you.
Yeah, I'll count on that. Okay. All right.
Thanks, Zahir. Bye-bye.